incision, a second incision, once they get into the skin, they'll go underneath their vastus muscle, so they don't do quad cutting, okay? So muscle sparing. But this person, she had a quad splitting surgery. So I want you to identify her antagonistic muscle group. Her hamstrings. Good. So now I want you to instruct her, or actually I want you to set her up in a position where she's going to strengthen her hamstrings. An open chain position on the table. You're going to need to use something. You're going to need to use something.
Or if they're
Daniel, set her up properly with the towel. And then Regina, if you want, if you can, one pound. Let's say just 1 pound.
Is it okay to lay in an incision like that?
Okay, well that's just what we're getting to.
That's what we're getting to. That's fine.
Okay, so first of all, Regina, why wouldn't you want her to do the exercises with her knee pointing into the
You want to put a post
right? So just put her leg down, put her leg down. So what bone is now compressed? The patella. So you want to avoid compression at the patella. So
Right.
to avoid that, you're going to position the towel so
above the knee.
Okay. So now the question is, can she withstand pressure against her incision? So if the incision is closed, there's no drainage per se, and you're doing an exercise, and the exercise is going to be 30 seconds, 60 seconds, however long it takes to be in this position, yeah, that's safe, that's fine. Do you want to instruct your patient to lay here and sleep and take a nap? No. But for a simple, quick exercise to strengthen the hamstring, you can safely do it. So now, go ahead and have her do 5 reps.
Okay, do 5 reps.
Okay? So what if she's only able to go to 60 degrees? Okay, do 5 reps to 60 degrees. So Danielle, you're watching that, and what are you thinking?
Obviously, she's not strong.
Okay, so you say that she's not strong enough. So not strong enough for what muscle? In what? Her hamstrings. Okay, so I'm going to say I disagree. So now, Regina, you're going to say why can't she go ahead and flex up to 90 degrees or 100 degrees? What's limiting her?
Her quads.
Yes, her quads. Because of what?
Her hip flexors.
Not necessarily the hip flexors.
The rectus.
Not. It could be the rectus if she was already tight. But think about the surgery she just had.
She split the quad.
Yeah, exactly. So she has swelling.
Pain.
She has pain. So exactly. And also when they go ahead and they either staple or suture that quad muscle back, they can go tight. So until they remove either the sutures or the staples, the skin is going to be taut. There's nerve receptors in the skin that are sensitive to stretch. So if you are a therapist and you make the mistake of doing this, if she's going to 60, and you're saying, well, no, I want you to go to 90, and you can be too aggressive and hurt them. So I'm showing you things that you want to avoid, but at the same time, you still want to strengthen the hamstring, and you can safely do that just by going right like that, okay? The other way, obviously, is you could have her stand and do this. So there's other alternatives. This is just more kind of to make you think on your feet. Okay? Patients are going to ask you these questions. CIs are going to ask you these questions. We will ask you these questions. Okay. All right, guys.
D.